Have you ever noticed that there are days when you feel totally light, like you have a bounce in your step and everything feels really easy? Your body's like fluid. And other days you feel like everything's stuck together, like your shoulders just won't glide, your head won't turn, your hips feel like they're just rusted together. Even getting out of a chair is like a lot more effort than you know it should be. What if that difference is not simply aging? What if it's the way your fascia is like perfectly responding to how you've been living? So today we're going to talk about the difference between what I like to think of as fascia that glides and fascia that's glued. And more importantly, let's explore some simple daily habits that can help your body move with more ease, so that by the end of this video, you'll have some practical tools you can use every day, from a physical therapist who's seen it all, without spending an hour stretching on the floor. Hi, I'm Dr. Melanie Carlone. I'm a physical therapist, somatic practitioner, and really a lifelong student of the incredible intelligence of this body and what's been built into it. And one of the reasons I love talking about fascia is because it's changed the entire way we think about pain, we think about movement, how we actually move, how we think about stiffness, and what it takes to heal. Because fascia is not just this material wrapping around your muscles like plastic wrap. It's this living, responsive network that connects every cell in your entire body. And just like a garden that responds to exactly how you care for it, your fascia responds to how you move, how you breathe, how you rest, hydrate, really how you experience the world. So the question is, what keeps fascia gliding instead of feeling glued, and how do you get and stay there? So people often ask me, how do I fix this scarring, this tightness, this fascia? But fascia is not something you just fix once. It's something you influence and you live into every day. Healthy fascia thrives on variety, on your attention, and the quality of your movement. It loves gentle changes in pressure. It likes rotation. It likes breath. It likes walking and reaching and twisting and changing position. By contrast, hours spent in one position can make the whole system feel less adaptable, not damaged or broken, just less dynamic and less resilient. So, if fascia loves variety, what daily habits can you start to adopt that help provide that? So let's start right now. You don't need to wait until the explanation's over to begin feeling it in your body. We'll build explanation into it as we do it. And this is actually one of the beautiful things about fascia. You understand it better when you live into it and you experience it. So, wherever you are, just let yourself sit a little more comfortably and become aware. Or stand if that feels better for you. Let your feet touch the ground. Let your hands rest. And just notice. Before you move, where do you feel the most stuck? Feel through your body, your feet, your legs, your belly, shoulders, low back, your neck, your jaw. You don't have to fix it. Just notice. And that's already the first habit, is bringing your attention out of your head where you're focused on some exercise, something you're up in the world, bringing attention to your body, because fascia responds to attention. Your nervous system responds to attention. Your body begins to reorganize when you stop fighting it and you start listening to what it's telling you. So let's listen with movement. Slowly first, let your eyes move around the room, okay? And just notice, this is called orienting. Let your eyes move and let your head follow. And just be present right now to the moment. What colors do you see? What shapes? Notice your breath as you move. Just bring yourself right to the here and now, which is not a place many of us are. Let your visual field widen with awareness. Don't rush. Just arrive to where you're at right now. Your head kind of gently follows your eyes. That helps to break it up. A little to the right, back through center, a little to the left, and follow. Little up, little down, and small, just really easy. It's not a stretch. You're not trying to move your neck. It's orientation. And orientation matters because fascia doesn't live separately from the nervous system. When your body feels safe where you're at and present, it absolutely moves differently. When your nervous system gets the message, I'm here, I'm supported, I don't have to brace, everything's okay, you're present. Tissues begin to soften before you ever force a stretch. All right, so you've oriented now. Now pause and notice your shoulders, your jaw. Notice where your breath is coming from. Did anything shift from this orientation even a little bit? That little shift is information. It's fascia responding. It's your body leaning back towards you because you're listening. All right, let's bring it to breath. Bring your hands around your lower ribs if that's comfortable. If not, just put hand on your front ribs, side of the body kind of, and we're going to explore habit number 2. Breathe into the back of your body. Feel around behind you. Breath is not just about oxygen. Every inhale creates this amazing subtle movement through your ribs, your spine, your diaphragm, even your pelvis and shoulders, and all the connective tissue between them. So instead of trying to take a huge breath, just invite a wide breath and imagine inhaling behind you. Let the ribs widen out and back. Let the breath come around to the sides, then the front, and then slowly up into the chest. It's a very powerful form of breathing. Back, sides, chest. And exhale without effort. Inhale, low back, the sides widen, let the front of the body receive, let the breath filled rise into the chest, and just exhale and release. And again, low back, sides, front, chest, release. Let's do a few more of those. Breathing into the back, awareness in the back, sides, front, chest, release. And as you breathe, notice, are your shoulders trying to help? It's not that it's wrong, it's information. Because when you breathe with the upper chest, your body's getting the message of, uh-oh, we got to get away from a lion, because neck and shoulders help that breath. So try breathing without bracing. Side, front, chest, let it go. And that can make the upper body feel more relaxed instead of tight or trying to help. When the breath moves into the back of the body, your whole system gets a different message. It's not vigilant around front. The fascia around the rib cage gets movement. The spine gets movement. The diaphragm gets movement. And the shoulders don't have to work quite so hard. So 3 more breaths now. Low back, sides, front, chest, and release. Low back, sides, front, chest, release. 1 more. Low back, sides, expand from the inside, chest, release and soften. Release your hands and just pause. And notice your torso. Just let the breath breathe you, but notice your shoulders and your neck. Notice your face. This is what I mean when I say fascia likes moving from the inside out, not tensing or forcing, but inhabiting inside of yourself. It's a really interesting concept. All right, let's give fascia a little more variety now. We're going to move. So as you exhale, slowly spiral to one side. Let your ribs rotate, your chest, your head, and then inhale back to center. Only as much as you want to. You don't need to force. Inhale and then exhale. Inhaling, low back, front, chest, exhale, wring it out. And wring it out. And you might start to notice that your spine actually releases this wringing, not with force, but actually with power, with a sense of attention and concentration. Extension, expansion, compression, rotation, exhale. It's like you're growing wider on the inside and you have more control over the release. Okay, 2 more either side. Back to center, inhale, exhale, spiral, turn, inhale. Feel like you're expanding like a sponge filling. Let your spine be involved. Your body's not isolated pieces. It's all connected. exhale. Inhale back to center. And fascia is part of that conversation. All right, so now just pause and feel. You probably have a lot more awareness, like maybe you feel bigger. Do you notice your breath changed? Maybe your spine feels more awake. Maybe one side's more available than the other. That's really important. It's not about correcting it, it's about noticing it. Because observation itself is an input to the whole system. Now we're going to explore the habit that you can take on through your shoulders. Move more often, not just harder. Many people think they need a hard workout in order to get fascia to move, but they simply just need more movement throughout the day. More small messages, frequent reminders, okay? More variety. So let's bring it to the shoulders. Lift them. Just not a shrug of tension. Just let them float like a balloon, filling from the inside. Pause, and then lower them very gently. Keep breathing low back, front, chest, and exhale like ice melting in the sun. Breathe, inhale, shoulders float, all the way up to the chest. Exhale, let it melt down. And again, low back, front, chest, shoulders, pause, feel it, and then let it melt. And you can even make it smaller. It shouldn't hurt at all. Maybe the shoulders only move a quarter inch. Maybe they barely move. Can you feel the beginning of that pattern? Can you sense the moment before you grip? The moment that matters? Because when you can feel the beginning of a pattern, you have more choice. And fascia responds to choice. It responds to movement that feels safe in the body. Now, I want you to add tiny little shoulder circles. Small ones forward. Doesn't have to be big. Not big exercise circles. Just see how small and smooth you can make it, like you're exploring from the inside. Let your breath continue. Your jaw soft, your tongue rest. See if you can fill low back, middle chest, circle, easy, slow, and curious. It's not about doing it perfectly. It's about reminding connective tissue. You can move here. I have options here. I'm not stuck. And now pause, let everything down, let your arms just rest. And notice your shoulders, your neck. Notice the space across your upper back and below your neck. These tiny movements become messages to the fascia. It starts to experience itself as bigger, as more available. Keeps adapting, keeps listening. And as fascia adapts, it becomes more vibrant, more electrically charged, more responsive and alive. And that is wonderful news for the body, because it means change doesn't always require this huge dramatic intervention. Sometimes it begins with just small movements done with awareness, right? So let's bring the shoulders into the whole body. Reach your right arm slowly across the body towards the left. You don't have to touch anything, just exhale. And then inhale, low back, mid, chest, and then exhale again. Pull your belly in and reach. You don't have to go really far, but start to feel how your shoulders connect to your hips. Inhale, exhale, compress. Inhale and return. So these are all things you can do at your desk. You can do driving at red lights. Reach and rotate. Let your head follow. Come on back up. The spine participates, right? Feel how motion doesn't belong only to the shoulder. It's like the whole body. Your ribs help, your spine, your breath. Your pelvis may even begin to respond. That low back rib breathing. Now instead of one thing trying to do all the work, like when you're motionless, the whole body gets involved. And the opposite side of your body. So when you reach to the left, what gets involved on the right? Feel it all the way into the neck, the shoulders. Expansion, compression. Reach to the left, what gets involved? Reach to the right, what gets involved? One more each side. Exhaling, low back, belly, chest, and exhale and reach. Pull your belly button to your spine. One more each side. Beautiful. And now notice your breathing. Notice the weight of your arms and your feet. That's why movement throughout the day matters. It's not just workouts and stretching. but little moments of reaching and rotating and breathing and changing position and inhabiting your body, not just your head. So let's check in again. Where did you feel the most stuck when we started? And now tune in. Is it the same? It's probably different. Is it more awake? Softer? Does it feel kind of warmer or more available? Or you're simply just more aware of it? Because that counts. Awareness is not separate from healing. Our awareness is how the body begins to update its internal map of what's possible. You can even try this. That place that's always tight, try asking it, what are you trying to tell me? And then listen, pause. Because maybe it's saying something about, I got stuck. I need your attention. I need your compassion. I need breath. I need rest. I need you to stop ignoring me. There's no wrong answer, and everybody's different. But your body communicates in sensation, not in words. So leave a comment. Let me know, how did your body feel most glued when we started, and what changed as we moved? It's just totally fascinating how differently each body organizes tension. So let's close with one more short reset you can use anytime during the day as you work with fascia. Sit or stand comfortably. Let your eyes orient. Let your head follow. Breathe into the low back ribs. Let it widen to the side and to the belly. Chest. Exhale and just let go. Feel yourself expand from the inside. And then reach across. And expand, low back, belly, chest. And then exhale and compress, reach. Right? It just takes a minute. Orient, breathe. Your fascia doesn't need this whole huge workout. Your presence and this kind of motion, small reminders, frequent variety, breath, rotation, attention, movement, all begins to make a vast difference for you. So today, remember these first two habits more often, not just harder. Breathe into the back of your body and rotate, expand, low back, belly, chest, compress, and come back to the center. These are really meaningful messages. They tell the body, you are allowed to move, and I'm here. I'm here to adapt. I'm not stuck. I got it. It's amazing. You take one step towards your body, it takes 1,000 steps back towards you. So in the next video, I'm going to do 3 more habits that help fascia glide. And we'll talk about changing position. I want to talk more about hydration and minerals and reducing unnecessary guarding. And we'll explore this standing sway practice I called being kelp. So you get more fluid and connected and alive. So before you go, I'd love to hear from you. Where did your body feel glued? What shifted? Leave a comment. And importantly, if this video meant something to you, please subscribe, pass it on. Because when we start to see what we do in a new way, our body starts to lean back to us in a very different way. So be kind and compassionate with yourself. Breathe with awareness. And remember, your body was built for movement. It was built for your inner habitation. And your fascia is always listening to the way you move through the world. See you guys later.